introduce you to the Idra device here from SBM Systemi. It's core to my dry eye practice within a clinical setting. And really it has brought innovation to the dry eye diagnostics, including things such as meibography, interferometry, tear meniscus height, and very many other of the diagnostic techniques that we use today to come up with that positive diagnosis and also grading of dry eye disease. Interestingly enough, it's simple enough to sit on any slit lamp application or as a standalone unit. But what it does is it provides us pretty much a one-stop shop for the diagnostics of dry eye conditions as we understand them today. To take the image that you require, it's quite simple. Ask the patient to move the chin forward and forehead against the bar at the top. Here we have the Idra, which we can quickly move into place, moving forward and back. You can actually move the device slightly laterally to avoid some of the nasal features if you needed to. The device has two cones, quite innovative in their technology. The first here has a 90-degree sector, which is white, that allows us to measure the tear film thickness of the lipid layer, so that's interferometry. Here we have the Placido ring technology, which allows us to look at the non-invasive tear breakup time associated with evaporative dry eye. The Idra device from SBM Systemi in Italy actually is unique within the market. It allows us a whole portfolio of different tests that actually are combined within a software package that allows us as clinicians to understand the dry eye disease, but more importantly, inform patients. Let me show you just an illustration here of what is unique. We have a structure of the meibomian glands that is evident, and we can create a three-dimensional model of this. Patients love that. We can look at the quality of the tears. We can look at the lipid layer, the interferometry. There is one other company, Tear Science, that offers interferometry, but it doesn't integrate it within a system that allows the story to be told about other conditions within the dry eye syndrome. So here we have at the bottom a third test, which is actually looking at the blink dynamics, how the lids close. We're only getting a partial blink here. So we're getting different pieces of the jigsaw coming together. We have the anatomy and structure of the glands that produce the oils. We have an image that allows us to analyze the thickness of the lipid layer, and then we're getting the blink dynamics. And it tells a story. It tells a story to the patient that actually we have a green, which is okay, a red, which is severe dry eye, and we have a mid layer here, which is actually a moderate dry eye. So we can see the lipid layer thickness, we can look at the meibomian gland structure, and we can look at the lid structure. We're getting a snapshot in time. Today we can analyze this, we can start a treatment. Once we've done the treatment, we can analyze it again and show patients how effective that treatment is. It helps us diagnose patients, it helps us in terms of monitoring patients, and it drives compliance so that patients comply with the therapy, and that all drives the patient back in to see me as a clinician, or drives them back in to buy various drugs and therapies that we're actually prescribing. So this is something we can see on a longitudinal patients.